years ago, aid organizations promised to provide safe and clean drinking water for the people of Bangladesh by building tube wells across the country. But instead of clean water, a recent report has found that tens of millions of people here are still being exposed to high levels of arsenic in the water. I'm Kathy Hearn. This week on 101 East, we look at how a plan to help one of the world's poorest countries went horribly wrong. Bangladesh is one of the world's most densely populated countries, home to more than 150 million people. The demands on healthcare, education and security are huge, but none more so than the demand for safe drinking water. Once a month, 37-year-old Salma Begum makes the short trip from her village in western Bangladesh to this street. She's visiting her local community health clinic for a checkup.
I have several complications in my body. My hand and legs ache. The black spots are there and I'm very weak physically. I often suffer from fever and coughs and colds, and day by day I lose weight.
Salma has a disease called arsenicosis. It's caused by drinking water contaminated with arsenic, which occurs naturally underground. She was diagnosed by a visiting doctor more than 10 years ago.
When I found out it was arsenic, I was very upset because my husband is poor. So how am I going to get treatment and buy medicine? I was very worried, but the doctors told me not to worry. They would bear my treatment costs. They also told me to eat more green vegetables and fruit.
The spots on Salma's hands and feet are a typical sign of arsenic poisoning. If left untreated, they can swell and multiply and possibly lead to various cancers. Even though Salma's whole family drank the same water, she was the only one who fell ill.
I asked the doctors why no one else in my family was ill. They said my kidneys could not clean the arsenic. They said my body isn't strong enough to fight it, and I have low immunity.
It's much like smoking. You could be drinking arsenic for your whole life and got nothing, and you could die at age of 40 of cancer.
The arsenic came from this tube well, which pumps water from a few meters below the surface. Salma's father-in-law installed it when she first got married over 20 years ago.
Drinking from tube well is a kind of status symbol in Bangladesh, because previously those who don't have a tube well, probably people say, oh, they are poor, they even cannot have a tube well of their own. So it became a status symbol. And 95% of the people in rural Bangladesh has access to tube wells.
Millions of these inexpensive tube wells were installed across Bangladesh in the 1970s as part of a safe drinking water campaign led by international aid agencies such as UNICEF and the World Bank. At the time, many people were dying from waterborne diseases like diarrhea and cholera because they were drinking contaminated surface water from Bangladesh's rivers and lakes. People were encouraged to use tube wells to access the supposedly safer underground water instead. The result was a public health disaster as millions became exposed to water contaminated by arsenic.
Their knowledge was simply not there. Arsenic testing didn't go routine until much, much later, even in the United States, even in Europe.
I joined in '96, and that was when the whole arsenic story really started getting into the international media and getting publicized.
It took 20 years before the link between the contaminated drinking water from the tube wells and increasing cases of cancer was established. A doctor in neighboring India had discovered arsenic poisoning in several of his patients and traced it back to Bangladesh. By that time, 97% of people in Bangladesh were drinking from tube wells.
The road to hell is paved with good intentions. I think in most cases in Bangladesh, especially relating to arsenic, this has been the reason. In hindsight, it's very easy to say that the due diligence should have been made, etc., etc. Unfortunately, it wasn't.
The problem with arsenic-contaminated water is that you can't see it, you can't taste it, and you can't smell it. And the associated health problems like the skin lesions and the cancers take many years before they manifest. This man has lesions typical of an arsenic victim. He's never been to hospital for a diagnosis, let alone treatment, and he says they don't hurt. So far, he hasn't shown any other side effects, but he is aware of the implications.
It causes cancer of the lungs and other organs. It is toxic or harmful to other organs like liver, kidney, bladder, and causes cancer of all those organs. It also causes disease like involving the vascular system like heart and blood. So it can cause hypertension, diabetes, and lung diseases. So virtually it affects all organs of the body. It's a very nasty poison.
Arsenic certainly affects children's intellectual function. This is actually kind of surprising because people had thought you need a long time for arsenic to have any health effect on human.
Salma's family don't drink from their tube well anymore. Her children boil pond water and occasionally drink from an arsenic-free tube well in the nearby village. But Salma only drinks rainwater. She doesn't trust any tube well to be safe.
I clean my utensils like plates and glass here and use this water in the washroom and toilet. Sometimes we wash our rice with this, but I never drink it.
The arsenic problem in Bangladesh is the magnitude of the problem is much higher than any other country in the world. Bangladesh has more than 150 million people, and half of the people are exposed to arsenic.
And even though not everyone exposed to arsenic-contaminated water will get sick, its long-term impact on the country is corrosive.
So all of these other health damage will actually not only harm the people, but also harm their ability to generate income, which is a big economic drain on the country.
Professor Kwamara Jaman heads the Dhaka Community Hospital, world-renowned for its work in arsenic mitigation programs. It was his doctors who raised the alarm about the contaminated tube wells in the early 1990s. The professor and several colleagues wanted to establish a private hospital that didn't rely on aid money.
It is an attempt to develop something whereby a healthcare system for majority of people who are a bit low income, which is nearly 60% people who cannot afford private treatments, and without any foreign donors' help, their own money, and also developing a system where community participate, take their own decision, and above all accountability to the community for this healthcare system.
Here, patients' families bring food and linen to keep costs down. There are no set visiting hours. Open windows and fans blow in fresh air rather than air conditioning. Staff feel their own part of the hospital and don't just work here. After field workers had met patients with symptoms of arsenic poisoning, the hospital started an intensive research project. But its findings were initially ignored.
So we got nothing happening, and we know this is causing cancer. So we got in touch with our friends abroad.
Eventually, their research was made public at the annual World Health Organization meeting in 1997. When the story hit the headlines, the Bangladeshi government was forced to acknowledge the problem. Millions of dollars of aid money poured in, and after an initial slow start, arsenic mitigation campaigns got underway. Bangladesh's health minister told us his government is committed to delivering safe drinking water for the whole country by next year, as part of its commitment to the United Nations Millennium Development Goals. He says progress is being made.
Our statistics or our impression shows that the problem of arsenic is getting lower and lower. People are more aware. People knows that this is not cancer, this is not like leprosy, this is not like every other thing. Because we have been able to campaign very much against arsenic and also to make people aware about the arsenic problems.
Salma agrees with him. She says her neighbors no longer shun her.
তারা আগে অনেকটা মনে করতো ওখানে মনে করে না এটা কোনো ছোঁয়াছুঁয়ি রোগ না ওইটা কোনো বিষয় না
They used to think this was infectious, but now they know the illness comes from the water and is not infectious. They don't mind. They have campaigns on the television and they hear that proper nutrition will help fight the sickness.
The awareness campaigns are working, but what is still unclear is where all the aid money went.
Bangladesh doesn't do too well on the governance index, so obviously there's going to be leakages.
And is it even going to the right places?
Arsenic is a complicated problem, and that it takes a lot of people, a lot of hard work to solve this problem. There's no single magic solution.
So how does Bangladesh, mired in debt and overpopulated, face the challenges of a problem that keeps on getting bigger? After the break, we travel west with Professor Kwamrujaman and his team to visit the district of Pabna, the area where the first patients with arsenic poisoning were diagnosed. And we look at what aid organizations are doing to try and fix the very problem they helped create. Stay with 101 East. It's been described as the biggest mass poisoning in history. Millions of people in Bangladesh exposed to arsenic-contaminated water from tube wells that were first installed in the 1970s. To see the situation today, we left the capital city of Dhaka with Professor Kwamrujaman from the Dhaka Community Hospital. We were travelling 5 hours west to Pabna to visit one of the hospital's health camps. It was there that doctors first raised the alarm about arsenic poisoning in Bangladesh.
We come here, this is the patient or person we first saw in 1996 when we were doing a health camp, and this is the one first we saw as an arsenic patient. It was much worse, which she cannot even make a fist.
Her condition improved after the tube wells were replaced with other water sources.
We got a program here where we get arsenic-free water, which is very important. We put some rainwater and just normal dug well, and she said since she used the arsenic-free water, she's better now.
But for some it was too late, as the years of exposure to the water took their toll.
She's saying one of her sister-in-law died with cancer with arsenic and then developed cancer, and his son as well. So I think mentally also she's very worried about her situation. এখন তো অনেকেই বুঝতে পারে যে এটা arsenic তে হয়েছে, তাই না? Well, she's saying that in 1996 nobody knew what is the problem, but now they know it's arsenic and they don't drink arsenic water. They say that is reducing now because people understand about the arsenic, so they take precaution not to drink the water.
The tube wells were put in to make their life easier. Is she angry that those tube wells were put in?
No, that is the thing I was trying to find out. Actually, people here in this part of the world, they believe in fate, and they don't blame anybody. They just want to know what to do.
We left the professor and headed back north to meet up with Faraduddin Khan. He's the project director for a large-scale arsenic mitigation program being jointly run between the World Bank and the Bangladeshi government. And this is the road to a nearby village. Well, at least it is for part of the year. But when the monsoon season starts, the only way to reach the village is by boat. And even though there is water all around us, none of it is drinkable because of bacterial diseases and extremely high levels of arsenic contamination.
We have conducted survey in 2003 and 2004. The arsenic contamination is more than 80% and above. We call them hotspot area. So for intervention, we address the hotspot area in the beginning.
The World Bank project helps raise awareness of where the arsenic hotspots are.
That is why we paint it as red. To aware the people, this is arsenic contaminated tube well, please don't use this water for cooking and drinking. Other tube well, as we seen the green one, this is the deep tube well. It ranges from 700 to 800 feet. So the water is completely safe from arsenic.
The other part of the project is educating people about the long-term dangers of drinking the arsenic-contaminated water.
information, education and communication, like poster, leaflet, then print media, electronic media, traditional folk media. So different media we use for create the awareness among the people.
The irony is that back in the early 1970s, when the aid agencies first planned to sink the tube wells, many villagers were opposed to the idea, calling it a plan to access the devil's water. Today, more than 5 million of the estimated 10 million tube wells in the country have been tested, but the goalposts are constantly shifting.
We have some longitudinal study which indicates that a tube well that is not arsenic contaminated at the time of the first testing may eventually get arsenic contaminated over a period of time because of the geobiochemical reactions that take place there.
And to make matters worse, arsenic in the soil is now contaminating rice and vegetable crops. A joint publication from the World Health Organization, UNICEF and other NGOs released this year highlights the problem of crop irrigation using water from contaminated tube wells.
The simple matter is when you put arsenic in the soil, most of that doesn't leave.
This arsenic buildup then gets into the rice grains and is being consumed.
But more significantly is there are studies in many countries, including Bangladesh, Taiwan, Japan, that shows when you have arsenic in soil, the yield decreases, and quite significantly. So that's a food security issue.
But in the short term, it's unlikely that Bangladesh can reduce its reliance on irrigation from tube wells.
I think I would focus on a security issue, managing the rice field, emphasizing on water condensation and looking for alternative source of irrigation, which is going to be very challenging. The agriculture sector needs to start looking at that now before it becomes, again, headlines all over the world.
There are many technologies available to access arsenic-free water, from cheap to expensive. The headache is determining which ones work best for each area. One solution proposed by the World Bank is to sink deeper tube wells that will bypass the arsenic in the groundwater. So far, over 9,000 deep tube wells like this have been installed, and there are plans for a lot more. Another solution developed by the World Bank is linking an arsenic treatment plant to a piped water supply. After the arsenic and other contaminants are filtered out, the water is piped through to the village to around 1,000 homes. The government and World Bank want to install another 170,000 new water points, but UNICEF says the country should be looking further ahead.
If we restrict ourselves to water points only, to me that's an opportunity missed, because it's a development and we're a development agency. We need to think what the country should look like 20, 30 years down the road, not, putting out the fire today.
Critics also say many of these projects only work when the NGOs are here to supervise them, but once they're gone, they're not maintained. The World Bank says it's aware of this problem and has handover plans for each of the projects.
From the date of successful commissioning, they will continue to run the project 15 to 18 years.
There is also disagreement between aid agencies over what are the right solutions. UNICEF, who focus on sanitation issues for children in Bangladesh, claim mitigation work is not being done in the right areas.
One would think you want to then, since you know where the problem areas are, you would then target your mitigation in those areas. Unfortunately, that doesn't seem to be what has happened. The reality is, after 10 years, the water points that the government were able to allocate in collaboration with the donors and so on, went mostly to areas with the least amount of arsenic problem.
The blaming game is, it's nice. I mean, it's nice to blame somebody. But having worked in this sector, having looked at people, I think I have to get past it now. What we should be doing is learning from the mistakes that had happened in the past.
And while NGOs argue about the best way forward, questions are still being asked about how foreign aid for water projects was distributed.
Do you think that money has been wisely spent?
Not entirely. it could and should have been better spent. I think there is indecision on parts of many people, the stakeholders here, and the critical stakeholders would be the government, the critical stakeholders would be the development partners.
How would you do things differently?
Actually, I don't think you need to do differently. What they're doing is not bad, but the thing is that there's no coordination, no effective planning, no accountability.
It's a problem with all forms of development agencies, is we are very target oriented. We forget that we are serving people. We should focus on people and keep the primary focus that they are a client to whom we are delivering a service. We are not doing them a favor.
A joint concerted effort is definitely needed to face this challenge. This is a serious challenge, no question about that.
But even with a more coordinated approach and more donor money, the challenges that face the decision makers are enormous. Meanwhile, those who live with the illness on a daily basis, like Salma, are more resigned to their situation.
It was in my fate. What can I do? The doctors are giving me treatment and I'm doing the best I can. But God has given this to me and I can't do anything about it. It is in my fate.